Hey, everybody. Welcome to the Dojo. I want to talk about the patient journey. This is the most important thing that will make or break your practice. It all starts from how a person is marketed to, whether that's you're doing Facebook, you're doing any type of means of social media, print ads, magazines, streaming television, regular television, radio ads, business alliances within the organization. All of this sets the tone. It's the first impression that a person will experience to your office. So that is part of the patient journey, is how you're communicating from what you're putting out there to the very first phone call, or if you're doing a contact submission through social media, the website, making sure that the follow-up is very quick. We're in an era of everybody wants something right now. So let's just talk about the example of having a marketing event where you have a $49 special and the person's coming into the office. You make sure that they're scheduled out. They have a map to your office. They have their intake form. They know that they're going to complete it ahead of time, and they're going to arrive to the office with their insurance card, their driver's license, a list of medication, and their completed paperwork. This is setting the tone for a great first experience in the office. So they'll arrive for a day one, which we call the initial office visit. They will check in at the front desk. Their insurance will be verified. Their paperwork will be completed. Any additional forms will be done at that time. And that person, while they're waiting, can read some type of informational brochure. I'm going to show you a couple here, whether it's nerve function chart. If they're in for neuropathy, you can give them some information on reading in regards to neuropathy. So have educational brochures that people could be reading while they're waiting for the case manager. Oftentimes people have never been to an office, so we want to educate them on what's going to happen during that visit. Then the case manager or the doctor, depends on who does that in your office, will come and greet the new patient. They will have reviewed the patient intake form before even shaking their hand. It's very important you understand, what is this person's name? Do they have a spouse? What do they do for work? What is their primary complaint? What do they have going on? How is it affecting them? How long it's been affecting them? The worst thing I hear in recordings is people saying, "So, welcome, Bob. What are we seeing you here for?" They just spent 45 minutes filling out paperwork. Please do not do that. That's the first way to invalidate somebody. So we want to make sure we review everything. We know who this person is, what they have going on, how it's affecting them, what do they enjoy to do in life, and where specifically through body charts on the intake paperwork. Now we're going to give them a tour in the office. Many times people feel nervous to go into medical facilities, not really knowing, and they kind of put their blinders on. And many of you guys, you open up the doors and people walk into a rehab space, they're like, "Oh, what's going on here?" So it's just like giving somebody a tour of your house. You want them to feel very comfortable when they arrive. The restrooms down the hall. If you need some water, it's right here. This is the rehab bay. This is where we work on strengthening areas of the body. Down this wing of our office is all of our medical services. Our chiropractic happens over here. And we also do weight loss. So this is our weight loss room. If you see red light coming from there, that's what we're doing. So please go ahead and have a seat here. And then we're going to start the cascade format. You're going to start the CAS portion of that. That is, what is the complaint? How is it affecting them? And what is the level of severity? Now, if you need some help with that, or you've never heard that term, let us know. We have a whole program around sales and education, specifically for chiropractic and integrated offices. We're going to be the investigator. We're going to ask them questions that no one has ever asked them before in any other type of office visit. Our primary goal here is to make a person feel valued, heard, and understood on that day one visit. We're getting them to tell us all of the ways that it's having an impact on their life, because people make a decision in two ways: avoidance of pain or pursuit of pleasure. And the reason why they're in your office is they're dealing with some type of pain. So we really want to make sure we understand what's going on, where's it coming from, what accidents and injuries they've had, what are their goals. This is a really, really, really big part of what needs to happen in day one. You ask goals and you at least get 3 of them. And a goal is not to be out of pain, but if you didn't have this pain, what would you be doing that you're not doing right now? This is a golden nugget, and you have to have this at day one. Once you've got all that information, you want to spend some time educating. What you're going to do is tee up the examination portion, whether it's with a nurse practitioner or a chiropractor. Have some type of educational brochure specific to what they're in for. Now, again, neuropathy, we would be looking at a form that looks something like this, that we're going to be checking for large and small fibers. We're going to check for hot, cold, vibration, sharp, dull. If they're doing a chiro examination or physical medicine examination, we're going to talk about the vertebral subluxation complex. This tells the person how the nervous system works, what subluxation is, and the 5 components that the chiropractor will be doing. So range of motion, muscle testing, palpation, x-rays. We want to have something that is printed, because this is fact. Whatever comes out of your mouth could be opinion. So we want to show that there's validity behind what we're doing. So we investigate, then we educate. So we're building that desire to return to the report of findings to truly understand, why are they experiencing what they're experiencing? And then we're going to do a provider handoff. This is very important because you spent the time investigating. We want to make sure we do a great handoff to the provider, whether that's your nurse practitioner or the chiropractor. We're going to let them know, Dr. Bob, this is Jennifer. Jennifer's in because she has low back pain that's radiating down her left leg that stops about her knee, but she does feel that both feet are very weak. She's afraid to go out and run, which she loves to do. She hasn't been able to do that, and that's affected her emotionally. She's also having some neck pain, which is causing migraines twice a week. This is debilitating for her. It's affected her ability to go and work and be able to take care of her household stuff. This has caused some anxiety and depression. She has seen a physical therapist, and it didn't really do anything for the neck or the low back. So she's really desperate for what can we do to help her move in a direction of better health. Now, that is the pass off in front of the patient to the provider. So the patient knows that the provider knows everything about them, and they don't have to tell the story over again. We need to be efficient in the patient journey, so we're not passing somebody off and now the doctor's spending another 30 minutes with that person getting the exact same information that the case manager did. So let's think of efficiency, because we want to be respectful of the patient's time as well as being respectful of the clinic's time. So the doctor will go in and then reiterate what they're looking for in the examination. How does that feel? Yes, you have restriction in range of motion. So that's that first component. We know you have symptoms elsewhere in the body. Then we're going to do some muscle testing. So again, we go back to, this is fact. This is how we do our exam based off of facts. And they're being educated now twice in the first visit. We do x-rays, and we build the urgency to say, Barbara, I really want to see you back tomorrow with Bob. I'm going to get you in as soon as possible. You've been suffering for a long time, and we're already seeing some things on the x-rays. So let's take you on up to the front. Now that baton pass, I always say it's like the 4-man relay. It's really important that we're passing the patient appropriately from the case manager to the doctor by doing the education portion of what's going on with them. Also that emotional readback from the doctor to the front desk saying, I want them back tomorrow with Bob. So now that front desk person can pick up the baton and say, hey, doctor wants you back in tomorrow. Looks like afternoon works best for you. I have a 4 or a 5:15. What works best for you and Bob? Get them scheduled. Then we check them out. So collect any necessary payments for x-rays, the medical exam, whatever you need to collect, whether that's copayment, coinsurance, or portion of the deductible. Then we're going to schedule that report of findings within 1 to 2 days with their spouse. So really it's important that the doctor tees that up and then hands it off to the front desk. On day 2, the patient is going to check in. They're also going to be given some other information. It'll probably be different from the day before. There's a great pamphlet by Back Talk Systems. It's called Types of Care, which goes over the initial intensive care, rehabilitation, and into wellness. We want to be planting seeds in the patient journey right from the get-go that there is going to be continued care along the way. Then we move into case management, and we go into the report of findings appointment. So you're going to do education first here, and then we're going to present the CADE portion of the Cascade format, which is what is the concern for the future? Do they acknowledge even that they have a problem? If they don't, you got to go backwards a little bit. And then are they demanding for something different? If they are, we're going to then move into the exchange portion. So as you see, that's an acronym for all of those steps. We're going to do x-ray review. It's very important that you pull your doctor in to go over those x-rays. And we have a very specific way that we teach clinics to do this because we want the patient to own their own x-rays and be able to point it out. You don't have to be a radiologist to be able to point out something that doesn't look normal. That's why we do education before we go into x-ray review, and it would be going over the subluxation degeneration chart here. So that's normal through phase 3 degeneration. So we're going to educate ahead of time, and then we're going to ask patients, show us on your x-ray what looks like degenerative changes. Hey, what happened to the curvature in your neck? They're like, oh my gosh, it's going backwards. So we want them to be able to point out so they own what's happening in their own body. We do the emotional readback. Everything that they shared with you on day 1, we're going to package that up and read that back to them. And then we're going to have them make a level of commitment to themselves, not to the office, but to themselves. After we go over, this is what's recommended. This is how many times you're going to be in here. These are the policies that the office. How committed are you to doing this for yourself? When they are a 10 out of 10, we move them to exchange. And that's where we go over what does it look like to participate. We'll cover the financials. We'll go over any fee for service or supplemental policies. How you have that set up in your office. They'll sign the paperwork, and then the case manager is going to work out the entire treatment plan right there in the room. It should just take a few minutes. We're going to start you out at 3 times a week for the next month. What days work best for you? Monday, Wednesday, Thursday, in the afternoon time. Does 4 o'clock work for you? Great. So know your guys' schedule too. This is really important that you see on a day-to-day basis when the clinic is busiest. Try to push people in other directions where it's not so crazy. Your front desk and the rest of the staff will appreciate you for that. So you'll say, great, 3 times a week, Monday, Wednesday, Thursday, 4 o'clock. After that, what 2 days do you want to keep? Monday and Wednesday? Perfect. We got you all scheduled. I'm going to schedule all your re-exams as well, and everything's taken care of. It does look like 4th of July. We have a little bit of a conflict. What day would you rather do instead? You want to do Thursday or Friday instead? Okay, we could do that. Granted that your office is open, or we could do another day like Tuesday. So just know your schedule, have the calendar there, have all the holidays on that calendar so you can quickly look at a glance. So this is going to create efficiency on the back end when your front desk is looking at 4th of July, depends on if it's Thursday and you're closed Friday, that there's already no appointment scheduled on those days. Why? Because you did the makeup visits right at the report of findings appointment. So get efficient by handling the schedule all at one time, and it's easier on your front desk people. Then you can really engage with every single patient that comes into the office. So we're going to then pass that back to the front desk, who's going to take the payment and work on scheduling out the patient's calendar. We will move them to treatment, whether it's rehabilitation, decompression, chiropractic, medical service. We're going to deliver services in every single encounter from that time forward is going to be focused on patient education, checking in with them. Are they moving towards the goals that they told you in day one? That makes a person feel valued, heard, and understood. If we're all remembering as a team what their goals were and moving forward, hey, did you get out and run the 2 miles? Are you walking your dog to the mailbox? Did you get to go to Disneyland and do all the things with your kiddos? Did you go on the hike? Remember the goals of your patient, because we're educating every time they come in, every visit after that. And then making sure also that your re-exams are scheduled in. That's a time for your patients to give you feedback, and then you discover any things that are going on with them. This is one thing that I see that's dropped out so often is re-exams just don't happen. And so the patient doesn't know, like, hey, am I moving in the right direction? They'll start feeling better and they'll tell you they don't need to come in anymore. Why? Because you didn't educate them. So education needs to be a part of every single encounter. We work with offices and we tell them it's the S's, the symptom, supplement, service, or special of the week. That's what we need to be talking about. And it needs to be everybody's on the same page talking about the same things. So we want to make sure that we're focused on function versus feeling. Okay, so we're not asking people, oh, how are you feeling today? We want to see what changes have you noticed since the last time you come in? How's it going towards your goals? And then a good table talk and education, like I've said. So we're going to do our re-exams. In those re-exams or patient encounters, when they're saying their wins, we're asking for referrals, which then sets that cycle again where, oh, I want my husband to come in. I've been having such great results. Well, great. We'll get them set up with the front desk. Or they're telling you about somebody else that's in their pickleball group. Well, Barbara, why haven't you asked them to come in? Oh my gosh, I don't know. Well, what's their name and number? I'll send it to the front desk and make sure they get scheduled this week. So don't be afraid to ask for names and numbers as well. After your re-exams, make sure that you have a graduation exam. They're graduating to the next phase of care, which goes back to this great little pamphlet by Back Talk Systems, which talks about moving into wellness or maintenance or membership, however you guys want to call that. So we renew them on the next phase of care, because let's be real. Do any of us stop having physical, emotional, or chemical stresses in our life? No. Is our body going to regress after we've been corrected and we don't do anything about it? Absolutely, yes. Studies have shown between 7 and 14 days, you get patterns of retracing. So the body wants to go back in that direction. So you're failing your patients if you're not making a recommendation to come in at least 2 times a month or even once a month. I would say 2 times is even better. But it's very simple. Analogy is just like braces. You wear a retainer to stabilize the correction that's been done. We want to do maintenance chiropractic to stabilize the correction that's been done with the patient. So there is your patient journey. Please don't forget any part of that. It helps people to stay longer, make it through their treatment plans, get the results that they need and want. That's the most important thing. And then this creates a practice that people are excited about. They've gotten amazing results, and they stay and they pay and they refer. And it's just a great time for everybody because your practice continues to grow and thrive, and you bring on more people and you fire yourself out of certain positions in the organization, especially owners of clinics too. We want to move you to that executive role so that you can mentor everybody else within your organization. So patient journey, I hope you see the value in that and how important each step is. Be intentional to do it really, really well. If you need help, we're here to do that for you. Be blessed, be a blessing, and we'll see you next time.